You must be 18 or over.
Now, a new study by University College London has discovered that there is little to suggest that depression is caused by a chemical imbalance.
So this has called into question what antidepressants do and how they work and administered. Now, one of the authors of the study, Dr. Joanna Moncrieff, joins us in the studio alongside Dr. Ellie. Good to have you both.
Good morning, both of you. Now, Joanne, can you
Thank
tell
you.
us a little bit about your findings and what they actually mean?
Yeah, of course. So there's been this idea around for a long time that depression might be caused by a chemical imbalance, particularly by a serotonin abnormality. And serotonin is one of the chemicals in the brain that facilitates the communication between nerve cells, transmits a message from one cell to another. But it's been suspected for a while that maybe the evidence on serotonin and depression wasn't that strong, but no one had really taken an overview of all the research. So what we did was to get together all the different research on serotonin and depression in the different main areas that it's been looked at in. And when we put it all together, we came to the conclusion that really there wasn't any evidence that depression was linked with a serotonin abnormality. Certainly there was no evidence that depression is associated with low serotonin levels.
And just briefly explain serotonin, how it works and what it does to it.
So serotonin is one of the chemicals in the brain that helps messages transfer from one nerve cell to another.
Right, okay. So your study sort of suggests that depression might not be always down to low serotonin levels. Are there any other reasons other than people's lifestyles and how they are in the world that would suggest that, you know, is depression just down to people's
life experiences,
or is there any genetics there?
So there's been lots and lots of research on the biology of depression, but serotonin, the links between serotonin and depression are one of the most thoroughly researched,
right.
and there's been masses of research on that over decades and decades now. There is evidence that depression is strongly linked with what happens in people's lives, with adverse life events, both in childhood and later in life. So my conclusion is that we're left with that evidence that suggests that depression is a response to life events, but not with any convincing evidence that there is a specific biological element to the causation of depression. Of course, there are things that go on in our brains when we feel depressed. It's not to say there's nothing happening, but we haven't been able to so far pin down any biological factor that's linked with depression.
So that's really interesting. I mean, it's actually blowing up my mind, if I'm honest with you. So antidepressants, is it a placebo then? Would you suggest it's a placebo that we're feeling, that if we feel better when we take the antidepressants?
Yeah. So many people have been told that antidepressants work by rectifying a chemical imbalance, and it has been the belief of doctors as well that antidepressants are doing something to the biology of the brain, and that's how they work. But there are other ways that they might be having effect. So you're absolutely right in that regard. And we know that they have a substantial placebo effect. When you compare an antidepressant with a placebo, if you look at all the trials together, there are thousands of trials, most of them done by the pharmaceutical industry, most of them very short term. If you put them all together, antidepressants are a little bit better than an inert placebo. But the placebo has a lot of effect, and it's also possible that the antidepressants have a bit of a sort of amplified placebo effect because people can recognise often that they're taking an antidepressant, and we know that if people think they're on an active drug, that improves their outcome.
Dr. Ellie, let's bring you in. Why are so many people prescribed antidepressants, and what's your take on this?
So it won't be a surprise to Joanna to know that I disagree with her, and I've been very open about the fact that I take antidepressants myself for anxiety. And I think that's important to mention, actually, that we use antidepressants actually for a lot of different conditions. So I take them for anxiety, somebody in my family takes them for an eating disorder, other people I know take them for depression. And they don't work for everybody. I'm always very, very sort of keen to say that. Look, I take paracetamol when I've got a headache, and it works. But I know that headaches aren't caused by a lack of paracetamol in my body.
Yeah.
And just like we have sort of the trials that Joanna's looked at that show that serotonin may not be linked to depression, we also have a lot of trials that look at, do antidepressants, whatever they do, Do they work to treat the symptoms of depression or OCD or anxiety? And just like we have the evidence that Joanna's looked at, we have evidence to show, yes, for some people, definitely not for everybody. And I say that to patients. And I could bring you in a whole lot of people who antidepressants don't work for. And I'm lucky that they work for me. But there are people for whom they do work very well, whatever they do to the serotonin.
Yeah.
You're not contesting that, I suppose.
So I am, yes. I mean, the trials that Dr. Ellie refers to, as I say, they show very marginal differences between antidepressants and placebo, and we can't identify a group that have a good response and a group that have a poor response. So we're left with this average response, which really is very small, and as I say, may be accounted for by amplified placebo effects, but also it might be accounted for by some of the changes that antidepressants make, some of the mental changes that they produce. So we know that antidepressants can have a slight emotional blunting effect, for example. Some people report that, and that applies to not only, you know, unpleasant emotions like depression or anxiety, but also to positive emotions. So that, of course, might also explain why they look slightly different from a placebo. And that effect might be helpful to people, but I think people need to know or consider that that might be one of the ways they're working, instead of being told that they correct a chemical imbalance, which we haven't,
I do worry though, because obviously there's like 8 million people on antidepressants, and someone might watch this and go, well, I'm going to stop taking them, I don't want to take them.
Yeah.
And you definitely can't do that, can you?
No, absolutely not. So it is important. It isn't really important to point out that this isn't sort of new data or a new study. It's merely a collection of cherry-picked papers to sort of look at sort of serotonin. People should not...
Sorry, Ellie, they weren't cherry-picked. This was a systematic review.
Okay.
Yeah, that's
people
not right.
should not stop taking their antidepressants, absolutely not, because if you do need to stop taking antidepressants, we need to withdraw you sort of slowly and carefully. And we know that they do work for a lot of different diagnoses, as we've said. And science evolves and it changes, and it may be that we look at antidepressants targeting serotonin, but there are other chemicals in the body, also other chemicals in the brain, that the SSRIs may actually be increasing. So, for example, if you take the antibiotic penicillin, it would recognize, your body could recognize it as another antibiotic in your body. It's not necessarily as simple as we increase serotonin, therefore this happens. It's a bit more nuanced than that.
Joanna, do you think we prescribe antidepressants too easily? We've only got 30 seconds left, but just a final word for you.
I think we ought to be taking a different approach to depression and not considering it primarily as a brain disease, and thinking about depression as a reaction to personal and social difficulties and how we can help people deal with these.
Royal College of Psychiatrists, just to finish up, antidepressants will vary different people. Reasons are complex. Important we look at each individual needs. We wouldn't recommend anyone stopping taking theirs and speak to your GP.
Really interesting. Thank you to both of you for joining us.
Thank you very much.